Harris-Trump debate dug into some important issues like health care that need background and context to fully understand. And a lot of the back and forth focused on the Affordable Care Act, often called Obamacare.
I had a choice to make. Do I save it and make it as good as it can be, or do I let it rot? And I saved it.
To clarify, Trump tried to get rid of the Affordable Care Act and came within one vote of doing it in the U.S. Senate. John McCain, who was an outspoken critic of Obamacare, ironically became the swing vote that preserved it. And to see why and where Harris and Trump stand today, it helps to look back on what the law actually does and how it came to be.
Nothing made me prouder than providing better health care and more protections to millions of people across this country.
President Obama signed the Affordable Care Act in 2010. It's a complicated law, but the concept behind it is fairly simple. Patients get more protections. For example, parents can keep their kids on their plans until they turn 26, and you can't be denied for having a pre-existing condition, among other things. And to help pay for those protections, the law required many to buy private health insurance if they can afford it, and the government subsidized coverage for many to make it affordable to them. And they created a website called healthcare.gov to compare the private insurance plans and buy one. But that requirement or mandate to buy private coverage or face a penalty if you don't was ironically something Obama ran against.
If a mandate was the solution, we could try that to solve homelessness by mandating everybody buy a house.
That concept of a mandate to buy private insurance was first developed and promoted by Republicans.
Everybody should have insurance. They should pay.
Mitt Romney implemented the concept in Massachusetts and promoted it as a Republican model for the rest of the nation.
Massachusetts is a model for getting everybody insured.
And when Obama's vision of universal health care failed, he latched onto Romney's concept and took it national. And at first, it was very unpopular among voters. In fact, opposition to Obamacare helped fuel the Tea Party wave of 2010. But Republicans in Congress could never get enough votes to overturn it. And that brings us to former President Trump. When he first ran for president, Trump promised something very different and very un-Republican. Trump promised health care for all, paid for by the government.
Everybody's got to be covered. This is an un-Republican thing for me to say.
Universal health care.
I am going to take care of everybody.
Who pays for it?
The government's going to pay for it.
But when Trump won and took office, he did not advance a plan to do that. Instead, he deferred to then Speaker Paul Ryan and embraced Ryan's House plan to repeal and replace Obamacare.
But very importantly, it's a great plan. And this is a real plan. But we're just going to talk a little bit about the plan, how good it is.
But Paul Ryan's plan that Trump had endorsed and adopted did not cover everyone as Trump had promised. Instead, the CBO projected more than 20 million people would have lost the coverage they had. It would have cut hundreds of billions from Medicaid, and critics feared that it could drive up costs for people with pre-existing conditions to the point that many could not afford it. And as the plan tanked in the polls, and critics said it was a mean plan, Trump then called the same plan that he had endorsed mean as well and effectively derailed it.
I actually used my term, mean. That was my term.
Well, Republicans called a vote to wipe out part of Obamacare and come up with full details on what to replace it with at some point later. And Senator John McCain said that would have killed off essential provisions and caused the whole thing to collapse and offered literally nothing with which to replace it. And that's why McCain cast the deciding vote to save Obamacare. In that same year, 2017, they also voted to phase out that mandate to buy private insurance, the most unpopular part of the law. And that was a turning point in which the Affordable Care Act became increasingly popular among voters. But throughout the rest of his term, Trump cut subsidies to insurance companies that offered plans on healthcare.gov, and he reduced funding for marketing healthcare.gov and funding for navigators who help people enroll. The Trump administration also backed a court battle to end the Affordable Care Act with no alternative in place.
I hope that they end it.
Through his last full year in office, Trump kept saying he had a plan to replace it, but he never produced it.
So why didn't you develop a health plan?
It is developed. It is fully developed. It's going to be announced very soon when we see what happens with Obamacare.
And then the Affordable Care Act, or Obamacare, survived the court battles, and Biden won the 2020 election. The Biden-Harris administration then restored and increased the subsidies and funding for marketinghealthcare.gov and the enrollment support, which brings us to where we are now. Now, as for Vice President Harris, back in 2017, when Republicans were trying to end the Affordable Care Act, she did support a plan to eliminate private insurance in favor of government-run health care. And that's context for this claim from Trump.
She wants everybody to be on government insurance where you wait 6 months for an operation.
But Harris has since abandoned her support of a Medicare for all type of system, and as vice president supports private health care options. So Harris says she would stay the course on this by maintaining and growing the Affordable Care Act, while Trump still prefers something different.
Obamacare was lousy health care, always was. It's not very good today. And what I said, that if we come up with something, and we are working on things, we're going to do it and we're going to replace it.
So just a yes or no, you still do not have a plan?
I have concepts of a plan. I'm not president right now.
When he was president, Trump approved rules to allow the import of cheaper drugs from Canada and consumer protections to restrict surprises in medical bills, but has not released a comprehensive plan to replace the Affordable Care Act.
And there are concepts and options we have to do that, and you'll be hearing about it in the not-too-distant future.
Meanwhile, the Biden administration signed a law to cap the cost of insulin, allowed Medicare to negotiate some drug prices, and cap the total cost of prescriptions through Medicare. And that cap on out-of-pocket costs starts next year, and Harris wants to extend that cap on drug costs to everyone.
We have capped the cost of prescription medication for seniors at $2,000 a year, and when I am president, we will do that for all people.
All context for the debate over health care policy as it relates to money, power, and politics.